think it's a really interesting program this year. For me, what's come up is that post-pandemic, some questions that haven't been looked at for some time have sort of reasserted themselves into the front of minds of many people across the sector, across hospital operators, across insurers, and across others. And one of them is cancer and the costs of cancer and how sustainable cancer is. You'll notice a lot of insurers are starting to play with, if that's the right word, the what is covered and what is not covered within their insurance policies. And at another level, the hospital operators are looking at how can they deliver good quality cancer care, but at an affordable price. And that is difficult. It's not just a private healthcare industry, it's a societal issue, but it has particular impacts in private healthcare. So we're going to look at that in quite a lot of detail. The other issue is that post-pandemic, we've got a general election next year. And so it's a forum into, can we look at, could the UK healthcare system be organized any differently? And if so, what would be the role of private healthcare? So we've got a number of speakers, which I can talk about, that will be helping us do that. And it seems to me it's the right sort of forum. That is it's a neutral one. LaingBuisson doesn't have a particular view, but that we, the sector, shall we say, can discuss these things. It'll be following on from the party conference seasons, but leading up to the general election next year. I think that's what's unique about this conference is we present a lot of data. People who have been before know that we pull together a lot of the FIN data. We specifically get data requests to FIN just for the conference. We do the same with Health Code, and they very kindly provide it for us. We also provide our own LaingBuisson data and our forecasts. So the conference is on the 11th of October. It's just the right time for people in the sector, particularly the hospital operators and clinics, to be going, okay, what are our forecasts for next year? And do the trends that are being highlighted within the LaingBuisson conference, do they match what we're planning for next year? And within that presentation of the data, again, former delegates will know that we do voting. We ask the wisdom of the crowds. What do you think of the forecast provided by LaingBuisson? And being over optimistic, over pessimistic, or maybe about right. And there's a chance to interrogate those forecasts. So that's really exciting, I think. So that's unique, I think, in the sector. Another thing that I feel is unique is the access to the senior executives, particularly chief executives. So, we've got, as keynote speakers, we've got the chief executive of the HCA, John Ray. We've got the chief executive of the new chief executive of the Cleveland Clinic London speaking. We've got the chief executive of Practice Plus, Jim Easton speaking. We've got the chief executive of Ramsay Health in the UK, Nick Costa, and we've got other senior executives, both from insurers and the hospital operators. And so the ability or the opportunity to be able to have a coffee with them afterwards, or ask them a direct question, or say, look, there's something I would love to chat to you about. That's sort of, I think, unparalleled in the sector, and is a really fantastic opportunity for delegates. And also within all the sessions, we do allow quite a bit of time for delegates to raise questions. We use this Slido functionality, which I'm sure a lot of people are familiar with now, but we also take questions from the floor, but we allow enough time for people to question or query or just engage with the content that's going on. We aim to provide a lot of good content, and we allow people time to interrogate that. Well, I think it's a great gathering of senior executives from across the industry, from the hospital operators and insurers, but also I try very hard to include the senior clinicians within the industry. So, for example, we've got the medical director from Leaders in Oncology Care, we've got a GP, we've got a clinical oncologist, we've got a clinical oncologist from overseas attending. And so I think if you want to influence the debate that exists between those three groups, shall we say, the hospital operators, insurers, and the clinicians, it's a great opportunity, particularly then for pharmaceutical companies to attend, med tech companies, also lawyers and accountants and financial services, those people who are in the debate about what's the direction of travel for some of these treatment options. And so I think it's really important, and particularly this year I'm excited because I think quite a few of pharmaceutical companies will be attending, and medtech is also will also be there. At some level, improved drugs and improved technology is a great driver of improved clinical care, and those things cost money. So at what level do the clinicians and indeed perhaps the insurers go, sorry, we're not paying for that? And others go, well, no, it's better for patient care. Well, yes, prove it in a sense. So there's a lot to debate in those simple questions. And so I think anyone who wants to be part of that debate and part of the resolution of that debate will be attending. So I'm really excited about getting people from not just that core group of insurers, hospital operators, and clinicians to attend, but that wider group will come along and contribute. Well, cancer hasn't gone away just because of the pandemic, and it's now assumed even more importance to some extent because of NHS waiting times, but also just generally, and particularly the cost of cancer care, and so we'll be looking into what it makes up the cost of the cancer care. So Dr. Suba M, who's the Chief Medical Officer at Aviva Health, will be posing within one of the keynotes, where can we be looking at what are the expensive bits while still providing good care? Everyone wants to provide good care, but is it in screening? Is it in diagnostics? It is in the drugs? Is it in surgery? Is it in palliative care, for example? So these things all need to be part of the debate, and so we're very looking forward to the questions that she'll be posing. And then we have, as one of the plenary sessions, we have people from Nuffield Health. We have the medical director of Leaders in Oncology Care. We have people from molecular profiling, and we have, as one of our sponsors, Check for Cancer on the screening end of things. That'll be part of the debate. And then also in the afternoon, we'll be looking more specifically at breast cancer itself. So as I speak on the day that AI for breast cancer mammography has been in the news, and we have one of the leading proponents of that here in the UK, Chiron, will be speaking. We have Bupa speaking, one of the senior executives at Bupa, who have come up with innovative pathways in order to address some of the issues that we've been talking about. And we've got two clinicians, one who's a clinical oncologist and another who is a GP in London, who will be giving their perspectives on where they think the direction of travel should be for treatment, or for the whole pathway of cancer. So we'll be looking at it in a lot of detail, and I think we'll hopefully not necessarily get to complete answers. That would be too much, but I think many members, many delegates know that these conferences try to help move the industry forward, and that's what the level of debate I think will be very interesting and valuable in this area as to what can be done in the whole cancer sector. The other main theme of the day, other than cancer, is what should or could the UK private healthcare sector look like after the general election next year. Building up to this, there's been a lot of talk in the media about, is the way the NHS is currently structured, is it sustainable? And it feels like an appropriate time for this forum and this seniority of executives from the sector to be discussing it in a very neutral way. LaingBuisson does not have a particular viewpoint, but as a keynote speaker, we've got Paul Blakely from the Tony Blair Institute. They are looking at this whole issue, not just as, to be fair, secondary care. They are looking at primary care, but they're in the process. These think tanks are in the process of coming up with their recommendations ahead of the general election next year. And we've also got Sebastian Rees from Reform and Jordan Cummings from the Confederation of British Industry, who have all been doing some work in this area about what could be done differently and what would healthcare look like. Contributing that debate, certainly at the end of the day, I've entitled it Aussie Rules, ? Should UK healthcare be more like Australia? It's a way of framing a debate. There are a lot of organizations in the UK also have organizations in Australia. And so I'm pleased that both James Sherwood from Bupa and Nick Costa from Ramsey will be there talking about insurance and being an operator in that market. And it may not be the right answer, by the way. Australia is just coming as we speak. We just finished the Ashes, so it's an interesting way of framing that debate. And I'm also particularly excited to have Professor Alan Spiegelman speaking. He is a clinical oncologist based in New Zealand, worked in the NHS as an oncologist, worked privately as an oncologist, that went to Australia, now as an emeritus professor at the University of New South Wales. So has experience of both countries, and so it has some interesting views. And so I think we're trying to bring in the views. Let's not idealize it. That's the right word. We're not think that everywhere else is better. We're not saying that. But I think it's a good way of framing the debate. And what I think is interesting, what we've decided to do that in order to help that debate we're going to hold that final session under the Chatham House rule. And the Chatham House rule, many people may be aware, is afterwards you can mention what was said in the debate, in the conference, but you can't mention who said it. And so that way is to make things more open. People can fly kites, if that's the right expression, or say things that they might not normally say because they're not necessarily representing their organization. But I think that will be really encouraging to see what comes out of that, actually. And I think I'm looking at probably what we'll do with the Slido facility is we'll have a bit of a debate and then ask at the end, okay, if there was one thing you could change about UK healthcare, what would you change? And that may be nothing to do with private healthcare, and maybe nothing to do with the NHS, but I think that'll be an interesting way to seeing, well, okay, what concrete can come out of this really interesting discussion. So there's going to be a lot there, and again, we'll feed into, I hope, into the general election thinking next year, and let's see if it's hopefully a valuable contribution. So we'll be looking at self-pay in the data section very closely, and we'll be interested, to see what the latest thing is. There are different regions are behaving, shall we say, differently than others. But one of the things we'll be looking at more specifically is there's an issue, it feels like in the industry, from the idea of converting inquiries into procedures. And believe it or not just hospital operators, but insurers have some similarity of concerns about that. So hospital operators they've grown significantly the self-pay outpatients and consultations and diagnostics. It becomes harder when they want to talk about actually converting to a procedure. So we've got a couple speakers there, one in particular, Leandro de la Porte from MedBell, one of the founders there. They have a very good system, shall we say, of that conversion. We've got Liz Woods, who's formerly of HCA, but she comes at it from a customer experience point of view. And then we have Chris Gilbert from Vitality, an insurance company that, in a sense, are also looking at it from the same perspective, which is a lot of an interest in private medical insurance post-pandemic, and how do the insurers demonstrate value to their customers when they're often, in the first few years, customers don't claim, but for insurers, which is good from one perspective, but how do they demonstrate value when it comes to renewal? And so that is a particular issue in insurance, because a lot of their first few years of the premiums goes to pay brokers' commissions. So it's not until later years, but insurers are aware of this as an issue, and in a sense they do want people to claim. They certainly want people to claim earlier in their pathways. And so we'll be looking at this from quite a few different perspectives, and that particularly would be around self-pay. We're also looking at some other areas where self-pay is more a background theme. We'll be looking at the shift to outpatients and day case treatments, and that is almost by definition is more affordable, and that is then more affordable for self-pay rather than the inpatient care, which can be very expensive. And so I think it's more outside of those two sessions, it's more a general theme, It's less relevant in cancer. There is still some self-pay in cancer, so we'll consider it in all the sessions that we'll be going through on the day. As many people know, one of the big drivers for hospital operators' revenues and indeed probably profits is orthopedics. And so we're taking a good look in one of the afternoon sessions about the new developments in orthopedics and are they value for money. And I'm delighted that Sarah Taylor and Mark Emerton representing AXA Health, very senior executives for an insurance company, and they'll be looking at presenting some new and exclusive data on how they've been looking at reducing variation, how they've been looking at how standardization, how they've been looking at trying to reduce the cost as well as improve the outcomes for orthopedics, particularly hip and knee replacements for their customers. And I think it'll be really exciting to see what data they have. We've also got Charles Gogagan, who's chief executive of the Clavido, which is a rehab center down in Guildford, new and exciting and full of self-pay as it happens. And he'll be discussing their service offering, something that the insurers don't normally cover, rehab, but he'll be discussing the value to patients of being able to go after a hip or knee operation, for example, and spend a week in a dedicated facility, going through rehab, and rather than go home and have your spouse look after you, and which can sometimes make it very difficult both for the patient and indeed for the spouse. So I think that'll be very interesting. And then very excited also, Jim McAvoy is the chief executive of the Fortius. This is the first conference that has happened since the takeover of the Schön Clinic by Fortius, and so he'll be talking about it, at least from a London perspective, of what it means for an orthopedic grouping such as Fortius to be now taking on an inpatient hospital in the Harley Street area, and that could have significant implications for certainly for Harley Street orthopedics. So I think there's a lot there in terms of getting your teeth into, shall we say, orthopedics.